mode.
Hi everyone, welcome to today's webinar on the Hazard Communication Standard Revisions and Changes to Inspection Procedures. My name is James and I'll be your moderator for today's event. Before we kick things off, I'd like to give you a brief overview on what the webinar is going to entail and run through a few housekeeping items. We will start with a slideshow presentation addressing the various elements of the HCS, how inspection procedures have changed, and what this all means for you. Following the presentation, there will be an open Q&A period. You can ask questions anytime throughout the webinar by typing them into the questions box on the right-hand side of your screen, and we'll address them during the last 15 minutes of the session. Everyone's microphones will be turned off for the entirety of the webinar, but if you do have a question, once again, you can use that questions box to communicate. Please keep in mind you will receive a copy of the slide deck and the presentation recording tomorrow, so all of the materials that are presented today you will receive tomorrow. Today's speaker, Rick Foote, is an EHS Consulting Services Manager here at Triumvirate Environmental. He has over 25 years of EHS experience and is an OSHA 501 instructor. Rick has spoken at many conferences around the country and has been a regular contributor to our webinar program. With that, I will turn things over to Rick. Hey, Rick.
Hey, James. Thank you. Good afternoon, everybody. As James mentioned today, what we want to talk about is the new OSHA directive regarding your hazard communication program. As everybody should be aware, right, the regulation has been revised and really we're on the final stages of the phase-in period. So that's why we thought this was a great time to do this webinar. As you can see here, OSHA has been very busy, when it's looking at trying to make sure people are actually compliant with this. This is, HAZCOM is always in the top 5, as I call it, never mind the top 10 list of violations. And, I pulled out here just the HAZCOM parts of it, and I thought to show you just how specific that it is. And we're going to get into, a lot of the parts of the rule here and their instructions on how to enforce it, because I figured to us, how else better to know than what they're going to be looking for. And I want to, start off by saying here too is that this is, there's like almost a 200-page document. So what I've done is try to hit what I thought is really the key items that you may, want to know about. And we surely don't have enough time today to go into, a lot of detail, but I did try to hit on, the biggest items that I could. So I do, suggest, and we'll put a link on, also to this, is to you to download the actual OSHA instruction for this regulation. So with that, we'd like to ask you, here's the question is, how ready are you to have OSHA come knock at your door?
And Rick, I just launched that poll, so we'll give everyone about 15 to 20 seconds to respond.
Okay.
Okay, so it looks like 23% are feeling pretty confident, another 52% are almost there, and 25% of our audience still has some work to do.
Okay. Interesting figures that some of you are that close. That's great. That's always a good thing to hear, right? Because we all know this, right? That this has been a lot of confusion around the regs, even my own self. I've been following it since 1999 when it was first proposed. So I sit there and go, wow, this is really, and even reading through the, the instruction manual here from OSHA, I found some interesting points of, that I can understand why people are confused. So with that, let's jump into, kind of getting ready. As you all know, preparation is the key, right? So that's number one. So if this is the actual, the compliance directive that was published back in July, and that's what we're going to go through today. Like I said, it's readily available on the OSHA website, and I do strongly suggest that you want to download this and maybe highlight certain areas for yourself and to look at what it is that's there. So the whole purpose of this, right, of the compliance this whole manual was to do what? Is to figure out how they're going to enforce this regulation. Because to me, the key to that is how do you be prepared if you don't know how they're going to enforce it? So they put into some great detail in this document to say, this is what you look for. This is the evidence that you need to prove that a facility is either in compliance or not in compliance. So that's really what's most important here, is about the enforceability of the certain items. In here right away too, it actually says about, because I know some of you are in, have state OSHA programs. It's probably quite a few of you on this call that's in it. I'm in one of them right now. And it's, to say that that the state plans, they can have their own policies, but this is kind of, as I say, you have to follow this one too, and then they can be more restrictive, but they have to at a minimum follow these instructions also. Because I know that's usually a question I get. Well, my state, it's a state-run program. How does this apply? Well, it came out of, if you will, the mothership, as I like to call it. And so this is just saying that, yes, you have to follow what they do. From here, you all should be familiar with these dates, right? So we're saying the last one, the final one, is June of next year, which is coming pretty quick, is, for the final implementation. This is it. This is, when we got to have everything in place, right? You are required to update your, to update any alternative workplace labeling and make sure that your written program is up to date and, make sure everything is really right where it needs to be, 100% done at that point. We just passed the June 1st deadline this year, right? Where most of you should be getting new safety data sheets. I'm sure if we had this as a poll question, how many of you have gotten a revised one? I'd be shocked if it was probably at, less than 20%, because from what I see out there, a lot of companies have not been supplying them yet. Some are better than others, obviously, but, it is what it is. And we'll talk about those a little bit more, too, as we go along. Okay? So in here, they called out some different things in here, and this list is not all-inclusive. The list is actually much larger, but I pulled out a couple of things, that I found were interesting to say, what is covered, like, wood products, hazardous drugs, combustible dust. It's that's a little bit of a more touchy subject here, is because the reason why that one's called out, it's like, okay, it's called out again afterwards and saying, well, it's covered, but it's not covered. But please keep in mind that OSHA is very close to releasing a combustible dust standard. So that is something you need to be thinking about. Now, when you see wood products also, I just want to clarify on the wood products, it's not just the wood, but it's also, the sawdust from the wood. So if you got a carpentry shop at your facility or something like that, you got to be thinking about that. Why? Well, because you got a combustion hazard, right? So they're looking at it because don't forget, this rule this time is also about, the hazards. Remember the physical and the health hazards. So with that, you have two different hazards. Certain things that are not covered in here are, again, radiation hazards, biological hazards. That the reason why those aren't covered is because they're already covered in a different, a different standard. So they figured, oh, okay, we already got those covered. So, but keep in mind is something like a biological sample, if it's packaged in an organic solvent or something like that, well, now it is subject to this rule, right? Because now the organic solvents are actually covered under the HAZCOM. So you got to look at the whole picture when you're looking at these things, and it's not, a one size fits all. Okay. So who is covered for this? It's really, again, I called out certain pieces because I want to make sure that you know this. I mean, most of you are covered, right? But these were a couple of items that I said, ooh, okay, well, let's make sure these are some good ones that people may not be aware of. Is, again, a quality control and production laboratories, they don't meet the definition of a laboratory, right? So it's not covered under the chemical hygiene plan program, so they are covered underneath this one. And this question I have gotten quite a few times recently is too, if your laboratory ships chemicals, then they have to meet the labeling and the safety data sheet requirements. So again, like I said, there's a lot of other pieces in here on who's covered, but I thought that it was a good idea to kind of just call out these two because it is a question mark. And if you're concerned about is a certain part of my operation covered or not, there's probably a good 10 to 12 pages worth of clarifications in here about who is covered and who is not covered. Okay, closed container handling. This one was interesting too, that when I looked in the, when you read through the regulation, what it was saying here is, because we get a lot of questions about this, like warehousing, right? What do we do in a warehouse? Is that covered? Well, what they say is that since all the containers are subject to leakage and breakage, employees who work in operations where they handle only sealed containers are potentially exposed, and therefore they need access to the information as well as training. Because that's another question that I've had about warehousing. We're just a big warehouse. We don't do anything. All we have is closed containers. What do we have to do? You still have to train them. You still have to have the labeling requirements. You still have to have the safety data sheets. And again, what type of training do you need? It's really dependent upon the types of chemicals that you have and what's the potential size of a spill or a leak. So therefore, you can tweak your training to match what you're doing at your facility. So you really want to make sure of that you're doing the proper training and not just covering, everything and anything. And like I said, we'll talk a little bit more on training afterwards. But don't forget, you still got to have the SDSs for every chemical that's in that facility, because there's still potential exposure to these chemicals. Okay. There is obviously the article exemptions, but some of the questions that they asked out there is, okay, but it might be an article, but does it have can you answer any of these questions? And how do you answer them? What is the hazardous chemical in the item to which the employees were exposed? So could they be exposed to something? Is it, was the item in because remember, you got to have your hazardous chemical inventory. I just had this discussion with a client yesterday. It was around chemical inventories. What do we need? How do we need it? Right? And part of HAZCOM is to say what? You are supposed to have a chemical inventory for all chemicals at your facility. And that chemical inventory should be located with your safety data sheets in whatever format that you want to do with those. So again, you got to look at that. Then if this material was released, again, back to, does it pose any physical or health hazard risk to an employee? As we said earlier, this is one of those, this rule changed dramatically in this aspect, is that they look at the physical as well as the health risk. So it's a combination of both. So it is one of those that's like, you got to look at everything. And they're looking at everything a little differently than they did in the original standard, which could be good or bad depending upon your situation. Okay. Mentioned combustible dust earlier, just because, again, it's in the standard. They put a lot of verbiage, I should say wordage. I don't think that's a real word. So we'll try that a little differently. I'll call it verbiage. It's, again, around combustible dust. And, again, it's covered, but it's not covered, and it's covered in certain situations. But as I stated earlier, please keep in mind, that they are in the process of developing the standard. I can't give you a timeline. I don't know. But I would expect we'll see it in the next year or two. And, that could change a lot of things that people do. Because don't forget, there could be a physical or even a health hazard around that dust, whatever it is that you may have at your facility. So that may be it. Hopefully when the regulation comes out, that I'm sure we'll be doing a webinar on that, to kind of get everybody up to speed on what that all means in the end. All right. So with that, what we're going to do now is kind of break down the standard a little bit, and we're going to cover it exactly in this order. We'll go over the hazard classification, labeling, safety data sheets, the written program, training, and then finally we'll wrap up with some questions, and hopefully I have some answers for you. Okay? All right. So the hazard classification part of this is only if you are the chemical manufacturer or an importer. Okay, because I get questions about this part of it too a lot. Has been about, well, wait a minute, what if, what do we do if we create the chemical? What do we do? Well, you're the manufacturer, right? Or if you import it, remember, you're still covered as a manufacturer. So those are the only ones that are required to classify the hazards of the chemicals. You do not have to go and reclassify or verify any of the information that's supplied to you by the vendor. That's 100% the vendor's responsibility, and it's not yours. If you choose to do your own, then you've got to make sure that you've done it in the way it's written out in the standard. And in the standard, it gets into a lot of details about how to do the classification. and what are the criterias here, okay? And again, in the requirements, they're outlined in Appendices A and B, and if you've seen those, they're pretty large documents as far as the information that's contained within them. So it does become one of those where, like, yeah, it can get pretty complicated with this stuff, so you need to look at it. And you got to make sure when you're doing that classification is, you got to do it for each individual hazard class, okay? And again, I want to stress that the standard clearly states that there is no requirement for you to have to do the testing, okay? However, in certain cases, that might be the only way you're going to determine if you have to, figure out what you have or what you don't have, you may have to do testing. But I thought this was interesting to find in there that it says directly that you don't have to do any type of testing. It's not required. It's whatever you need to figure out to get there. So classification criteria, again, for intermediates and byproducts, they are covered in here. So I know we get a lot of questions around intermediates. So again, if you're creating something and you've got an intermediate in between, guess what? That's covered, and you have to, it's not if the intermediate is just part of the process and it kind of doesn't get stored, I guess is a good word for it, then you might be okay, but it's when it's made, you got to still have, because employees can be potentially exposed. So those are covered and they have to be addressed in the hazard classification. Again, you can do that based on what? On the knowledge. You have knowledge of what you have, and you may, there's different ways of looking at it. Like I said, you'd have to look at Appendix A and B. You also have to look at the decomposition of products. Again, when you're looking at it during an emergency, so like plastics, diesel fuel emissions. These are a couple of examples that they gave in the standard, which I thought were pretty good. So, you got to be looking at what else happens. What if there was an incident of this, or something that's typically happened at your facility? You want to make sure those are also addressed in your classification. So on the intermediates, this comes directly out of this guidance document, and I thought it was a really good example, so that's why I included it word for word. I did not change any words out of this. This is verbatim. So it talks about, because I'm sure we got a few of you on the phone that are like, wait a minute, we have intermediates. So again, you got to create them. I really like the example here. Is in the process of creating the chemical E that is formed in 2 steps. You got A plus B equals C, and then C plus D equals E. The creation of C, is a stopping point, and it can be isolated. So therefore, you would have to do a hazard classification for that material. Okay. Now, as you can see on the other one, if it's not isolated or not discrete, so it's not like to stop in the process and that material, so we got it here and we put it on the shelf, or, okay, now we're going to do that, continue the process tomorrow or something, then it becomes, it's not, we would not need to have a safety data sheet for that. So hopefully that clarifies it for some people out there. Again, not to reiterate, I'm going to reiterate it, but it's in the standard that it really gets a lot more detail with that. So you want to make sure of what you have is covered or not covered. Okay. All right. So let's get into the best part of it, right? Because this seems to be where 99% of the questions that I see, though, is around the labeling, because there's a lot of confusion around what do we have to do, what don't we have to do, and okay, well, let's talk about it. So when we're looking at this, so the inspectors, what it says in there, they have to determine that the containers are labeled, and I love these words, with the appropriate information, that the labels are legible and the labels are prominently displayed. So what does that mean? Well, this is where we're going to talk about it now as we get into it a little bit stronger, as it clearly says all the labels must be in English. Okay? I see this a lot where people say, well, and you can have it in another language also, but you have to have it in English and then a second name. And they want to make sure that whatever you use for the product identifier can be cross-referenced to the safety data sheet and to the inventory list. So what does that mean? And basically saying here is that you want to make sure that whatever you got the name on the container is, it matches up to what's on the safety data sheet. So you can't have, Joe's mixture and then it's really, methyl ethyl death. So, you can't kind of do those things. It has to match. It would have to say methyl ethyl death. So you've got to be careful with that. Sometimes I have seen that where it's not, not correctly done. Okay. So then they also going to talk about here is they must have, if you're going to use a different labeling system. So, we're going to talk about HMIS, NFPA, any of those items. Okay. Because again, what does it say? It says that, you have to have some type of a labeling system, and they want to make sure it's effective. So they're going to go, and it states right in the guidance document here, if you will, it says they will do employee interviews and how many people to interview and what questions to ask. So that's very, very important that if you do have an alternative system, that you know that it's actually working and people understand it and that there's no real issues with it. And how do you do that is going to need to go around and kind of interview, everybody and make sure that most people, really understand it. Okay, because like they said, the most effective part of all of this is, how effective is it? Does it really work? Because the point of this is hazard communication, right? Is the information broken down well enough for the people? I always say with this is I strongly feel that like with training should be training to the group that it's with. Is, not one training fits all. And what I mean by that is, certain people are going to need more information and other people are going to need less information. So let's give them just the information that they need and, really focus on that. That way it makes it a little bit better and more effective when they do it. So again, they got to make sure that, and then, also it talks about, we're going to talk a little bit later on too about small containers. Because it doesn't say in the standard, because people have asked me, well, do I have to put a pictogram? I got a little vial or something like that. It's like, no, again, what works? How do you get that information to them? And they actually have a great section in here, all on small containers, that it actually will say, what you can do and what's acceptable, what's not acceptable. But it really gets into detail here is the case by case, because like they said, so can we label a box if it's just a bunch of small vials? Okay, that can be used, but does everybody understand it? Does everybody know what that labeling system is? It's not saying that you have to physically label every single one of those inner containers. Okay? So what else? You got to make sure you have the product identifier and the words, right? You can have pictures, symbols, whatever it is that's working for these. Again, preferably the pictograms, right? That's really what it is. And again, this is for your in-house labeling, it's not for, the containers coming from the manufacturer, whatever labels those are the ones to stay on there. So I just want to be clear on that. Okay, again, as it says here, you don't have to use pictograms. That's not, that you're not required for your in-house labeling, but it's important. To me, if you're doing it, that's okay, but you don't necessarily have to. But you got to make sure, like again, your precautionary statements and your hazard statements may be used again, but not required. So it's really the major part of the labeling part of this, I said labeling twice there, is that it's going to tell you that it's mostly the responsibility of the manufacturer. So again, if you are the manufacturer of that chemical, like we said, the intermediates as an example, then you need to ensure that the containers are labeled with everything. But when it's more of a workplace labeling, it's a little bit less stringent where you don't need as much information, but you still want to make sure that your employees are getting all of what they need out of it. So, of course, this has always been asked, can we still use the NFPA or the HMIS system? OSHA hasn't said no, but they say, you can use it as part of your system, but it can't, be contradictory in any way. And this is where, I read through this a couple of times because I was trying to figure out, all right, what's the best way to approach this subject? And they go into stressing a lot about the difference between the OSHA hazard ratings and the NFPA ratings. As you should be aware, right, under NFPA, like 4 is the most dangerous, where under OSHA 4 now in their risk categories is the least dangerous. So that can get contradictory, and that's what they're kind of looking at, is saying, wait a minute. So you got to be careful not to have multiple systems on the same containers, or even using multiple systems in your own facilities, because that can cause confusion. Because again, if OSHA interviewed one of your employees and you walked up to them and they said, oh, you know, what's the 4 stand for? And they say, oh, that's the highest danger, then guess what? That's a violation because it's incorrect. So you want to make sure that they can, you know, figure it out, and hopefully someday they'll figure this out. So again, a little more on the NFPA is, you know, you got to make sure that they understand. Again, training is the key here. And when I say training, though, everybody says, oh, how many hours does that take? It's whatever works for, you know, the effectiveness of your program. There is no requirement in the regulation that says you have to do, you know, any amount of time or anything like that on training. It's just you need to make sure it's effective. Because again, they want to make sure they can recognize whatever codes, whatever symbols, whatever, you know, I've seen people have used like a color code system. Okay, works as long as everybody knows what it is and it's effective, that everybody knows, you know, how to use it, that's okay. Okay, and then it says, you know, again, you know, for your workplace labels, have to have that product identifier and then general information regarding the hazards. Okay, no matter what, it still has to tell them something. You have to give them information. There is some other special labeling in here. Again, like combustible dust, you know, like flour, aluminum powder, carbon black. Then it has to be labeled. Any of those materials too would have to be labeled in accordance with the standard. But again, it goes again back to the manufacturer. So if you're making combustible dust or you're bottling it for whatever reason, you know, any of those materials, you want to make sure that it's properly labeled. All right, DOT labeling. This part I found was a little bit interesting. So the DOT, obviously you all know, requires the diamond shape, you know, they call them placards in this rule. And, you know, OSHA proposed the modification, but, you know, they figured that, you know, the pictograms, you know, they were afraid that the pictograms were going to be in conflict with the, you know, the DOT labels, but however, they said, no, it's okay, we will allow those. But it goes on to say that OSHA will allow labels to contain both the pictograms, the DOT pictograms, and the hazard communication standard pictograms for the same hazard. So what we're saying there is it's okay to have both labels. Like you're going to see that, and some people are saying, well, wait a minute, you just said things could be, you know, confusing, but now you're saying you can have multiple labels? Yes, because DOT and OSHA, and you're probably all aware, and even the EPA, the three of them don't like each other, right? I don't know how else to say it, but it's one of those like, yeah, they don't necessarily get along so well. So they've just recently revised this and make sure that you understand that yeah, you're going to see the multiple labels on there. So just make sure your employees are, you know, aware of that. Okay, so here's a great, you know, example is a 55-gallon drum, right, would be required to have the DOT and all the elements, the chemical classification, and it has going to make sure that the pictograms are for both. So the manufacturer or the importer would have, you know, one of two options here, right? They could have only the DOT pictogram for the hazard, right? Or they could label, you know, they can do both the pictograms and the DOT. Hopefully that makes sense to you when you see it. Like I said, again, I'll refer you back to the actual directive that has a lot more information in there. Okay, so let's talk about safety data sheets. So everybody should have already got these, right? So the new ones, I always love this, and like I said, that probably, James, might have been a great poll question too. How many of you actually got safety data sheets? New ones. Hopefully they're starting to trickle in more and more. But again, because this was supposed to have been done by June 1st, which has already happened, and you know they have to make sure that they're compliant. And I already know one of the questions I'm sure that's going to come up, or you know, and I'll hopefully answer it now, is do you have to go and haunt them to get a new safety data sheet? No, it's the responsibility of the manufacturer to get that and send it to you. So and if they don't get it, because what's happening is I'm hearing it, you know, I've heard it from a few people now that have said, well, you know, we can't update ours because we're waiting to get information from somebody else. And if you are the manufacturer and you can't get the clear information about, you know, let's say it's one of the ingredients, in your mixture there that they haven't updated it, you have to show, and I say it here, is a good faith effort on how to do that. Well, how do you do it? Well, you have to make sure you document that. You need to, show that, okay, well, here's the letters we wrote to them, or an email. I know most things today are done by email, but you want to make sure that you have records of that email trail that says, hey, we reached out numerous times. We haven't got any information. They're just not responding to us. That's the type of information that you need to. And then, if you have to, then, why didn't you do the clarification yourself? You would try to collect the data or maybe have it analyzed, whatever it is. So there's no real excuse here for anybody out there that might be a manufacturer. They want to make sure that everything is done and you've done everything you can. So now for your employers, like I said, if you made a good effort, to contact them because they haven't received it and still have not been able to receive one, and again, like I said, any type of a letter or anything like that, just do what you got to do here. You want to make sure that you've gotten everything that you can. And again, if you're not getting it, I love this part. They said if you're still not getting anything that you need, you can contact the area office. And in the actual directive here in Appendix G, they actually give you, a letter to do it. Okay. Also, I just want to stress too that sometimes, I know I've done it, some of you out there may have done it too, is you look at the safety data sheet and say, oh my God, this is wrong, or this doesn't look accurate. Well, you have no responsibility there into what to have to clear, to change that or anything like that. That's again back to the manufacturer. Like I always say to people, if you see an error like that, the best thing you may want to do is reach out to the manufacturer and say, hey, this might be, incorrect in what you have on there, or, we work with X product and maybe this is not accurate. So it is something you may want to do, or you don't have to do it either. Okay. This is a big one on the safety data sheets because, again, you have to make, you cannot require your employees, to perform like an internet search to view or obtain safety data sheets. So I've seen that with a lot of people today are saying to me, well, why do we got to have a paper copy or whatever? We just tell our employees go to the computer and find, and look it up. Well, it's clearly stated in here that that is not allowed, period. 100% not allowed. You cannot do that. Okay, you can do, like, a lot of you have now is you provide, companies pay a company to manage their, on a website or something like that. That is perfectly fine. However, you need to make sure that all of your employees know how to access that. I was recently with somebody the other day, and they said, well, yeah, we say, as long as we can get it within 24 hours and, blah, blah, blah. It's like, no, because the regulations say what? Immediate. Because why do they need to be immediately available? They need to be immediately available because what if somebody had an exposure to it, right, and you had to send them to the hospital? You want to be able to supply the hospital with the safety data sheet for that material when they get transported. Furthermore, here on these two, if, again, if you're maintaining them on a company website or anything like that, this is what, these are all of the requirements you need to make. So keep these in mind when you're looking at any of these services or anything like that. I know there's tons of them out there. Some are great, some are not so great. But you got to make sure that, again, here's a key word that I pick on here. It says that all employees have adequate computer. So it's not saying that, you got to have a computer everywhere or anything like that, but they need to know that you have, there's enough that they can get access to it. Especially on the off shifts, I see that a lot where, they say, oh yeah, but, the computers are all locked up at night. Well, that's not going to satisfy the standard, right? You also got to make sure that you have a backup procedure. And I always stress this to everybody. Computer systems are fantastic, right? They're great. But what happens if their server goes down? What happens if you don't have electricity? So you need to have a paper copy of it also. Is it the best way to do it? They don't say you have to have a paper, but, what else can you have? That to me, the paper is possibly the best way to do this. Most importantly, I think, is this third bullet down that says you got to make sure that if you are using a service, that you make sure that these people all of your employees, all, right, are trained on how to get to that information. So it's not just a matter of saying, oh yeah, we train a select few and they're in charge of going to get the safety data sheet. No, it really says in here that you got to be, anybody, if that's what you're expecting your employees to do, that they are there and they know how to access it at any time if they need to. Okay, so again, and then what do you do? You should have in your written program is any type of procedure or system in place so that if somebody asks for a copy of the safety data sheet, well, how do you do that? What is your system in order to do that? Okay. Also, again, I said they must have unrestricted access. So like I said, again, you cannot require workers to ask for the safety data sheet. That is totally incorrect. They give the example here, it is, stored in a locked office. So it's not, it's not necessarily, that's not a good thing, okay? So again, OSHA will not cite companies for maintaining any of your old MSDSs. When, again, if they were received prior to June 1st, 2015, that's fine. And again, as I said, you don't have to, the new standard does not require your employers to contact the manufacturers to obtain them, which if you already have, have the old MSDSs. Again, I want to stress that it's up to them, up to the manufacturers to be able to send these to you so that you know exactly what you have. Okay, so with that, let's talk about your written plan. Everybody has a communication plan. Well, you should, right? Nothing's changed there, but again, so what do you need to have? And this is, so really you got till 2016, if we look at the rule and we go by the dates and all of that, right, is you still had to, June 1st to be 100% compliant with this, and it comes down to saying, but okay, what do you have in your plan? And it's got to be, you want to make sure that, again, that includes in there the labeling. If you have multiple, if you have different labeling systems, you're not just using pictograms, you're using other, optional, like I said, color coding, using HMIS or the NFPA system or any of those things. That needs to be detailed in your written plan. Clearly states in the directive that they want to make sure that your written plan matches exactly what is being done in the workplace. Because the idea here is everything should match up perfectly, okay? Including like how do you do your safety data sheets. I've seen them where they say, oh, we keep them electronically. Well, that doesn't tell us anything. If there's a procedure in which to get them, like maybe you want to include in there login information, password, if there's a password, location, name of the company, their procedure, all of that information should be very well detailed in the written plan so that, everything's there. Then what do you train on? How do you do your training? How often do you do training? I hear from people all the time, they say, well, HAZCOM, we only have to train once, right? I'm like, well, technically, yes, right? That's what it says. But, however, if there's any hazards change at the facility, you got to do training again. And again, my rule of thumb, and this is a personal thing, is I say to everybody, it's not a bad idea to kind of go over HAZCOM training maybe once every 3 years or so. Why? Because people forget, and especially with these changes, maybe it's a great opportunity to see how effective your system is. Maybe throw a quick quiz at them on, a pictogram or something like that. It really, really helps to build it and make sure that people understand it and that they're comfortable with the new standard. Okay? So again, and this one, again, you got to make sure your employees have access to the written hazard communication program. In my old facility, we used to hang it up on the wall next to the safety data sheet, next to the master safety data sheet that was out in the facility. We would hang a copy of it up right there. And, it was readily accessible to anybody that wanted to look at it. I'll quite be honest with you, I don't know if anybody ever looked at it, but at least we had it available to them if they wanted to see it. Okay, you can have it in paper. People ask me the electronic information. Yes, it clearly states it in there. It's okay to have it electronically. That's not a problem. You've got to, keep in mind too that this plan, if you update this one, it may have effect on all kinds of other regulations. Don't have time today to get into all of that, but again, in the directive, it talks about the relationship to like your chemical hygiene plan, lockout, tagout, confined space. We can go on and on and on of all of that. But it's there. Again, they got to know how to access the document, and it's got to be freely open to them. And this is somewhat of a change from the old standard. I know somebody has already asked us, what's the difference between the two? Well, if you go onto the OSHA website, they have a comparison chart that shows the old standard to the new standard and what's changed. So I would highly recommend, if you want to go line by line, it actually looks at it section, I shouldn't say line by line, but it's more section by section on what the changes were. Okay? So what do you got to have in your plan? And these are all the things that OSHA is going to look for to see if they are compliant. Is you got to have the inventory, and the inventory must have the product identifier, for each chemical known to be present, so that it aligns with the safety data sheet and the label. So everything's got to match up, as I stated earlier. Okay? You also want to make sure that the inventory, it can either be for the entire facility or it can be for individual work areas. You can do either or both. Totally up to you. Okay? The inventory must include all chemicals present, even if the chemicals are stored or not in use. So it's every single chemical at the site. Okay? Again, it's got to make sure for non-routine tasks. Okay? Again, what are those? Any associated, again, with unlabeled pipes. So that's still from the old standard. Okay? And then finally, again, what methods do you have to allow employees to get it? So like I said earlier, if the SDS format, any method you got to do, however you do it, and you got to make sure that in there also you have the, how do you inform your employers about the different labeling systems that you're using throughout. So that's what they want to make sure. Okay. So again, in the labeling section, again, I wanted to make sure that this stuff was in there. Is you got to make sure the designation of persons responsible for labeling on ship containers. So if you're shipping, materials out, you got to make sure that you have this person designated. Okay, then you guys also designate a person responsible for workplace labeling. So it can be the same person or it can be two different people. And again, this is verbatim right out of the rule. Okay, a description of the labeling system, and then a description of the alternative system that you used, and then any procedures that you use to review and update label information, either anything you're doing internally because you have, you figured out something was different or wrong or anything like that. So you want to make sure that there is an actual procedure in there for how to do that process. On the safety data sheets, again, section of your written program, it says here, again, you got to designate a person responsible for obtaining and maintaining the safety data sheets. This is something looking at some plans, and I'm like, all right, you kind of put together almost a checklist and say, there's all of these items in there, and this is one that's typically not in there, is these designations. Okay, how do you maintain them? How are they, where are you going to put them? What's the procedures? Okay, and then what if you don't get a safety data sheet at the time of the first shipment? Some of you have processes in place that will say, hey, we won't allow it in our, to be received without a safety data sheet. Great, that should be in your plan. The idea of the plan here is just to match up and say everything is perfect, and this is all the process and the procedures that we have to ensure compliance. Okay. Again, more procedures you need to have in here is, what if it's suspected that the safety data sheet is not appropriate? It's missing something. What do you do? Okay, well, again, in your written plan, it should just say, okay, if something's missing or we feel something's incorrect, so-and-so, the person designated is going to contact the vendor, something that simple. Okay, again, how do you know that the safety data sheet is current? What's your process? Suggestion I have for that is, again, we used to have our purchasing person send out a letter at the beginning of every year saying, hey, can you just, it was a chain letter, if you will, was just saying, hey, can you make sure you send us the most up-to-date safety data sheet for all chemicals we purchase through you. We used to get maybe a 60 to 70% response rate out of that, but it was pretty good. But at least that was part of our procedure to ensure that we had the most up-to-date information. So again, it's up to you. These are all just, types of issues that we can show you or things that you can possibly do. So on the training part of it, again, designation of the person responsible for conducting the training. Is it in-house? Is it out-house? Is it, do you hire consultants? Whatever you do, it doesn't matter. They just want to know what you're doing. And then how do you do the training? Okay, is it using slides? Is it, online? Is it a webinar? Is it, a combination thereof? They just want to make sure that everything is detailed in there. And you got to make sure that the program addresses all of those things to ensure that everything is correct. Okay, what do you do? A procedure to train all new employees too, because it can't be that, oh yeah, we'll train them, yeah, we'll train them, 10 months from now. Again, there's timelines that you need to meet, and you got to make sure that they're always there. Because again, big part of it on the training is around employee interviews. And they say that, it must be evaluated through a program review and interviews with the management and employees. And they want to make sure that the adequate understanding of the workplace chemical hazards. And, it's not expected that they recall all the information in the training to be able to repeat it, but just so that they really understand the hazards that they have at the facility. Because that's the most important part of this whole thing, right, is the communication piece. And like I say to everybody, is communication is probably the thing that we all do the worst, right? I say it all the time, when I do training or something like that, I say, who here is a great communicator? And typically nobody raises their hand. And including myself, even though I do this stuff regularly, I always feel, oh, we can do better. So that was the whole idea behind this, program, is to get better communication with everybody. So kind of in closing here, our key message here is to make sure your program is compliant. And I am sure, hopefully, I shouldn't say sure, but I'm hoping that as we went through this, and like I said, I try to hit all the high spots, and there's a lot more detail in the directive. I actually have it sitting right here in front of me. But, again, all about, like in your written plan, these designated people, that's something that most people don't do. And how effective is your labeling program? Have you gone around and, just quizzed your employees and say, hey, do you understand what these new labels are? Do you understand the pictograms? I always say the one with the heart, that looks like somebody having a heart attack. What does that mean? When I do training with that, what I say to them is, what that says to me, and to me it's a key thing, and I talked to an OSHA inspector about it. I said to him, what I tell him when I see that one? I said, that one there, or the exclamation point, tells me to go to the safety data sheet. So because there's a lot of information on that one slot, on that one pictogram, so it's easier to say, hey, go look at that. That way there, you're, again, forcing them back to the safety data sheets so that they're going to review this information, and hopefully it'll stick. Okay? So with that, we are at the point for questions, James.
Great, thank you, Rick. Some great information, and I think our attendees will agree. There's plenty of questions already waiting in the queue. So with 10 minutes left, I'd say let's jump right in. We'll get to as many as we can. And those that we don't get to, just know that we'll follow up with you afterwards. So we won't be ignoring anyone. We just might not get to them all here today, but you will receive an answer. So Rick, there were a few questions that were pre-submitted in our content outreach a couple weeks ago. So I want to take a minute to address those. The first, and you may not be surprised, several of these, or most of them, are around labeling. This question asks, does the lab need to relabel all chemicals purchased prior to this initiative?
No. It's a very simple one. It says no. No, the requirements do not say that you need to do that. Again, it's back to the manufacturers, to do it. If you are a manufacturer, then yes. But if you already have the materials and they're sitting in your room, no. Is it a good idea to do? Yeah, but it says clearly in the rule that you don't have to necessarily do that.
Right, and that answers the question. You don't need to. Okay, thanks. What are the recent changes to the flammable definition?
Well, the recent changes was, what happened was OSHA has, OSHA's basically got rid of the word combustible. So it now flammable now encompasses anything that has a flash point from 199.4 or less. And again, you've got to go into the standard itself to get into all of the descriptions, because that's like a class 4 or a level 4. Yes, I'll call it. I don't want to say class because then it sounds like DOT. Is that one, again, it's all about, how you're going to manage those types of materials and all that. It's just really they struck the word combustible. So combustible is now strictly a DOT term only, not allowed in OSHA.
Got it. And to reiterate what Rick said, we will include a link to the instructions, so you'll get all the details and can look these items up further. What are the requirements for labeling secondary containers in a lab setting, and can I continue to use HMIS labels, or do I need to switch over to GHS format?
Again, like I mentioned earlier, that you can use, the HMIS, that's fine. It's preferred that you go to the GHS because, again, it can't have, any redundancy, I'm sorry, not redundant, any, conflicting information or anything like that. So what I've really been I tell everybody that I can is to say, hey, if you're going to buy new labels, why not go with the pictograms? Why not just switch over? Because otherwise, you're going to have two different systems coming in. So, again, you don't have to relabel everything. You can use the HMIS or the NFPA, as I stated earlier in the presentation. So those are definites, yes.
Great. You spoke about SDS access, and this question I think should be a pretty easy one too. If the SDS are on a computer system, do we need to have a hard copy in the warehouse as well?
I can't say that you need to have a hard copy, but all I can say is that you need to have a backup system, whatever that may be. Okay? Yes, preferably it's a hard copy. To me, that's the best thing you can do, but as long as you can prove that you can have access to it at some point, then that's okay. OSHA says that's still acceptable.
Sure, great, good advice. And similar topic, if we don't have the updated SDS from the manufacturer by June 2016, due to the manufacturer not responding, etc., are we held liable?
No, you just again show, as you said, if they've reached out to them, keep a copy of that, saying, hey, here's what we did, this is how we reached out to them, and this is, we got no response, so you just want to track that information.
Great. Another question, we store lots of new and old chemicals for a contracted project. Do we need to convert MSDS to SDS for each of the chemicals? The manufacturer of many of these chemicals may no longer exist, or the chemical may be discontinued already. What would you say there?
So I'm just I'm playing that one out in my head. So the manufacturer, but I would have to almost ask a question on a question, but it becomes one of these. If those containers are going to be shipped, outside, if they would, then yes, you would definitely have to, because anytime you ship something and then, somebody else is going to use it, you would definitely have to reclassify it, create a new safety data sheet, because, that's pretty well stated in the standard. But if it's just for internal purposes and you're just using it there, then I would go back to saying, well, no, because it says you don't have to relabel anything that, you're not using. Hopefully I answered that one. It's like that one's almost got another question to it that it's difficult to answer.
Sure. We can follow up with Eric separately and maybe ask that question to get a better understanding of his situation. So I think that helps.
Yeah, because that one, there's a little trickiness to it depending on what they're referring to.
Yeah.
Yep.
Is there a limit to training an employee if they constantly violate a hazard communication standard after repeated training and warnings?
Is there a what? I'm sorry.
Is there a limit to training an employee if they constantly violate the HCS? So I guess what do you do in this case? Do you just keep training them until they get it, or what would you recommend?
Yeah, really, that's what it says. You're supposed to retrain them and, completely on the standard and make sure it's effective. Maybe try a different. Is your training technique effective? Maybe is there a language barrier here, or is it just an employee that just doesn't care? And well, then you got a different issue, right? But really, yeah, you can try a different method. No, you can train them 1,000 times if you want to, but to me, I would look at it and say, well, why? What's the problem? Why isn't this employee necessarily getting it? Is it that they're not understanding it based on language or whatever your training technique? Maybe try a different person to do the training.
Sure.
Or something like that.
Yeah, that makes sense. Okay. If I'm storing a chemical supplied by a now defunct company, is it acceptable for me to find an up-to-date SDS for the same chemical from another vendor?
If it's exactly the same, yes, that is permissible.
Good. Nice and concise. We're a lab, and we produce thousands of small samples that will be tested in-house and shipped for testing externally. Are we subject or exempt under the lab standard?
Can you repeat that? I missed the first part of it, James.
Yeah. We are a lab and produce thousands of small samples that will be tested both in-house and shipped externally. So are we subject to this lab standard, or are we exempt?
If they're being shipped, then they are technically covered under the standard.
Right.
If they're being internal, again, back to the exemptions, is more than likely they'll be covered under the under the lab standard. So therefore they'd be exempt. But as soon as it's being shipped, now you're the man. Again, the shipping part of it drags them back into this as saying, no, you are part of the standard.
Okay.
So it's kind of yes, no type of scenario. Yes for ship, no for the other materials.
Got it. Okay. Finally, let's end with one or two more. We got a couple minutes left. Do you believe it's necessary to have an SDS management software system, or can a robust Excel spreadsheet serve this purpose for SDS and MSDS?
Yeah, I say whatever works, for your type of facility, or, and for your clientele, if, your employees to have ready access to them, or tracking, or whatever you're trying to do with it. No, that's how I always did it, and I had, hundreds of chemicals. I guess, for some of you got tens of thousands of chemicals. That might not be, really a good system, but, whatever works, yeah, do it. That's what I say. There's no requirement to have anything electronic or anything like that. I'm still old school. I like the paper copy. I like the paper system. So to me, Excel spreadsheet, if it works for everybody that's there, everybody can get access as they're required, do it.
Very good. Rick, so lots of questions still. Let's do one more, and we'll follow up in the next couple of days after the webinar. But let's get one more in. If we are a distributor, what manufacturer name should be on the label and SDS? Should it be our name or the actual manufacturer? If we do not want the customer to know where we get the material from, etc. Can we relabel with our distributor name and SDS?
If you're changing the name on there, if you become the manufacturer, so you put your name on there, then technically you are the manufacturer.
Okay.
So therefore you would have to, create your own, safety data sheets and, all of that for it with your name on it, versus, the other way. Because again, whoever is responsible for that material as the manufacturer, whatever name is on that container, it must be the person creating the safety data sheet.
Okay, I think that clarifies it. Yeah, great. Thanks for the answers, Rick. Plenty of questions, lots of interest, and we need to address and dig into this topic further as things start to roll out and that final implementation takes place. So Rick, thanks for presenting. As always, great job in providing insights here into a topic that is top of mind right now. And before we conclude, Rick, I don't know if you have anything else to add, but we do just want to make sure you fill out our survey. Let us know what you thought. We're always interested in your feedback as we continue to develop new webinars. And we want to make sure that you also let us know if there are topics that you'd like us to cover. So get back to us, and you will receive this presentation, as I said earlier. So Rick, thanks again. I really appreciate you coming on.
Thank you, everybody. Have a great day.
Take care, everyone.